Hey guys, thanks for clicking. Today we're going to be talking about disc injuries. We'll cover what they are, what we do for them, and what you can do for them at home to get some relief. Alright, cool. So a disc injury. Look, if you've ever had one, you know exactly how painful they can be. If you haven't, it's a lot like getting stabbed in the back repeatedly every time you move. So it's not a lot of fun. Now the reason why we get a disc injury is because of a long-term weakness in our low back. So if the muscles either side of your spine aren't doing their job properly, a lot more pressure goes through the discs and then they start to weaken, and that's when you get a disc strain, a disc bulge or a disc herniation, which are the three different types of disc injury you can get. The first type of injury, a disc strain, is sort of like getting a rolled ankle. So the outer shell of your disc stays where it is and stays intact, but you stretch it quickly and then it goes back to normal. That stretch creates a lot of inflammation and weakens the area. Now it is quite painful, as all disc injuries are, but it's usually the easiest one to fix. The second type of disc injury is a disc bulge, or a slip disc is what it's called sometimes. So that's where the outer shell of the disc weakens and then starts to push out in one direction. Now this can be a little bit more problematic because we have spinal nerves that sit either side of our spine, and if the disc bulges out in the wrong direction, it can start to hit that nerve and irritate it. Now what that will feel like is you'll get pins and needles, numbness and weakness in a certain pattern running down your leg. The third type of disc injury is a disc herniation. So this is the worst one of the lot. It's where the outer shell of your disc ruptures entirely and the inside of your disc, which is a little bit like custard, starts to squirt out the hole. Now, if you do have a disc herniation where the outer shell is ruptured, we may need to look at surgery as an option. Chiropractic, osteo and physio work really well at helping to heal the first two injuries, a disc strain or a disc bulge. Primarily, they use a distraction technique, so they're a specialized table where the bottom falls away. That helps to stretch your back and to get the disc to go back to where it belongs in the middle. That, combined with chiropractic adjustments, work really efficiently at strengthening up your spine, and then we introduce some core exercises to make sure that this injury doesn't happen again. The problem with disc injuries is that the more times it happens, the weaker that outer shell of the disc becomes, and the more likely it is to bulge or rupture if it's left unattended. So if you do have a disc injury, you really need to see someone ASAP to strengthen up the cause of what's going on. Because when the pain of a disc injury subsides, you've still got the weakness that caused the problem in the first place. So we need to get that weakness addressed so that it doesn't happen again and again and again and again. If you have a disc injury, I'd encourage you to contact your local Chiro, Physio or Osteo. Alternatively, you can give us a buzz on 9817 6611. We'd love to see you. Or you can click the link to make an appointment and we'll get in touch with you that way. Either way, you need to get in touch with someone to get this problem fixed. Now, there are a few things that you can do for me at home that will help with disc injuries. The first one is anti-inflammatories. So there's a lot of inflammation that's caused by a disc strain, bulge or herniation. So anti-inflammatories are going to be key at reducing some of the swelling. A lot of people get relief by putting a pillow underneath their knees if they're sleeping on their back, or if they're sleeping on their side, putting a pillow between the knees. That takes a lot of pressure off the low back and the disc so that they can start to chill out. The third tip is that you need to stay active, you need to stay moving. So getting up and going for a short walk every half an hour is going to be key, because if you stay immobile and stay still for too long, the research says is that your disc doesn't heal nearly as well as it should. Alright, so that's it for today's video. I hope you found a few helpful tips there to get out of pain. Again, contact your local Chiro, Physio or Osteo. Alternatively, give us a buzz on 9817 6611 or click the link to make an appointment. We'd love to look after you.